Today we're going to look at the top 6 exercises you can expect to perform following a knee replacement. If you're new to this channel, welcome. I'm Tim, and as a physical therapist, I've worked with patients within the hospital on day 1 of their knee replacement or even hip replacement surgery, and I've progressed patients in both the home health setting and within a physical therapy clinic. So while I've seen hundreds of surgical patients, this is most likely your first time having a knee replacement, and it can be a little bit scary because you're not quite sure what to expect. So in today's video, I'd like to cover 6 of the most important exercises you can expect to perform immediately after your knee replacement. So let's dive right into the first exercise. Okay, so this first exercise is called ankle pumps. You can perform ankle pumps in sitting or while lying down with your leg extended in your bed or your chair. Simply move your entire foot through the full range of motion, pointing your foot away from the body and bringing it back as far as you can towards the body. It's normal to feel a stretch in your calf when your leg is extended while you perform this exercise. And the reason we do this exercise is to promote blood flow and to prevent blood clots. The pumping motion works to draw fluid back up towards the heart, and it promotes good circulation throughout the legs and the entire body. Your goal should be to perform 10 to 20 ankle pumps on each leg every hour that you're awake. Now, it's a good idea to stay mobile during the day, so standing every hour anyways and performing ankle pumps every hour should be a part of your new routine as it is. So get started on the ankle pumps right away. This next exercise is called quad set or quadriceps contraction. The idea here is to restore strength to the quadriceps muscle so you can fully extend your knee and avoid buckling when you're standing. To perform a quad set, position a small towel roll under your ankle. Now tighten the muscle on the top of your leg as though you're trying to touch the back of your knee to the bed. Hold this for 3 to 5 seconds and relax the leg completely, repeating the sequence 10 times. Now, one trick to performing this exercise is to tighten the opposite leg muscle at the same time. In physical therapy, we call this co-contraction, and it's a great way to improve the strength of your surgical leg. For this exercise, perform 10 repetitions 2 to 3 times a day. Okay, this next exercise is called straight leg raise, and it pairs perfectly with the quad set exercise you just completed. To perform the straight leg raise properly, lie on your back with your surgical leg straight and your opposite knee bent. Tighten your thigh muscle and lift your surgical leg off the bed as high as you can or until it meets your opposite knee. Lower the leg and completely relax the muscle before repeating this movement for 10 repetitions. It's really important to avoid holding your breath while performing these exercises, so think about exhaling or breathing out while you lift your leg. And try to perform 10 repetitions of this exercise 2 to 3 times a day. Okay, so we're exactly halfway through the exercises. So far we've covered ankle pumps, quad sets, and the straight leg raise. Now let's look at the other 3 exercises you can expect to do right away after your surgery. The heel slide exercise is one of the most important exercises to perform after your surgery. While lying on your back with both legs fully extended, try to slowly slide up your heel towards your buttock, bending your knee as much as possible. It's okay to use the opposite foot to help assist in the motion, and it's even better if you're able to do this with a slick surface under your foot. Some patients like using a plastic bag on their foot to slide easier, while some use a paper plate under their foot. Now, this exercise may be progressed with a towel behind the knee to assist the knee into greater flexion. If you find that you can't go much further, try a few slow ankle pumps when you've reached the maximum knee flexion. This is a nice trick to achieve just a little bit more range of motion in the knee during a heel slide. The short arc quad exercise works to strengthen the muscle on top of your thigh, your quadriceps. To perform the short arc quad exercise, position a towel or a folded pillow under your knee while your leg is extended. In this position, tighten your thigh muscle and try to fully straighten out your leg, but avoid lifting it off the pillow completely. Hold this position for 3 to 5 seconds and then lower your leg back down to the surface. Now, just like the other exercises, avoid holding your breath and aim to perform 10 repetitions 2 to 3 times a day. Okay, we're going to do the last exercise, but I want to share something really quickly about sitting. I always encourage my patients with knee replacements to keep the knee in one of 2 positions, fully straight or fully bent as much as possible. Resting your knee in the middle somewhere is really tempting because it can feel the most comfortable position, but you only have a short window of time over the next few weeks to achieve the range of motion you need before scar tissue prohibits you from making any more progress. So this is a really important point. Sit with your knee fully straightened or fully flexed as much as possible. So this next exercise of seated knee flexion seems very simple, but is very effective for restoring your range of motion. You'll need to find a chair to sit in so your surgical leg just reaches the floor. Bend your surgical knee as far as you can, then slide your foot forward so it straightens fully. Perform 10 repetitions of this exercise 2 to 3 times a day. Now, similar to the heel slide exercise, you can mix in a few ankle pumps at the end range flexion to make this exercise even more advanced. So there you have it, the 6 basic exercises you can expect to perform right away after your knee replacement surgery. If you haven't had your surgery yet, it's a good idea to give these simple exercises a try right now so you have a better idea on how they should feel on when you're ready to do them on your own. Of course, your physical therapist will guide you through an appropriate progression based on your recovery. But I'd love for you to subscribe to the channel or playlist to see how I recommend progressing patients with exercises after a knee replacement. So you can subscribe at the bottom, and if you found this video to be helpful, I'd really love it if you gave it a like as well. I'll see you in one of those next videos where I perform all of these exercises with you in real time. We'll see you there.